Hello, everyone, and welcome to the fifth webinar in our fiscal year 2019 webinar series titled Maximizing Online Application Tracking Utilization, OAT, for SOAR Outcomes. My name is Pam Hine, Senior Project Associate with the SOAR TA Center, and I will be your moderator today. Before we begin, just a few housekeeping items to review. A quick disclaimer, this training is supported by the Substance Abuse and Mental Health Services Administration and the U.S. Department of Health and Human Services. The contents of this presentation do not necessarily reflect the views or policies of SAMHSA or DHHS. The training should not be considered substitutes for individualized care and treatment decisions. A few webinar instructions. As a reminder, your lines will be muted throughout the entire webinar. This webinar is being recorded and will be available for download on the SOAR website soon after. You may download now the presentation slides and other materials by going to the top left of your screen and clicking File, Save, and Document, or you can visit the SOAR website at soarworks.prainc.com. Click Webinars on the left sidebar and choose today's topic. We'll also have plenty of time for questions and answers taken at the end. We also have a new feature, a media viewer for the option of closed captioning and high contrast if needed. So to access the media viewer, you can just go to the right-hand side of your screen and you would accept if you need it, and click on the option that you would like there for, again, closed captioning and high contrast viewing. So just to go over some of the learning objectives today, it is our intention that by the end of this webinar, you will learn how to access and utilize the SAMHSA SOAR Online Application Tracking System, OAT, understand why it's important to track your SOAR-assisted SSI, SSDI application decisions, and also, finally, learn how to run reports to highlight SOAR success and promote quality. So to review our agenda today, to reach those objectives, we will begin this afternoon with presentations from Kristen Lutfer, Project Director with the SAMHSA SOAR TA Center. You'll then hear from Amanda Starkey, who is stepping in for Michelle Wolf, who is unable to join us at the last minute due to unavoidable circumstances. Amanda is the SOAR TA Center Liaison to Michigan. Prior to joining us, she worked as a SOAR specialist and trainer in Colorado and in Michigan since 2010. So we're really lucky to have Amanda today, who will review and add some of her insight into Michigan's transition to the OAT system. And then lastly, we'll hear from Barbara Moody Holbrook, who's a housing specialist and SOAR local lead with Southeast Florida Behavioral Health Network in Jupiter. So we're really lucky to have Barbara, who will provide the local perspective on utilizing OAT in tracking outcomes and monitoring quality. So to start us off today, we're really lucky to have Mark Jacobson with SAMHSA to provide today's welcome. Mark?
Thank you, Pam. A warm welcome to all of you joining us today. On behalf of SAMHSA and the Homeless Programs Branch of the Center for Mental Health Services, I would like to welcome you to this SOAR webinar titled Maximizing OAT Utilization for SOAR Outcome Tracking. OAT stands for Online Application Tracking. As many of you know, SOAR helps states and communities increase access to Social Security disability benefits for eligible adults and now children and youth who are experiencing or at risk of homelessness and have a serious mental illness, medical impairment, and/or a co-occurring substance use disorder. Today's webinar will focus on how to easily utilize SAMHSA's OAT system to not only track SOAR-assisted SSI, SSDI claims, but also how to summarize your outcomes and produce unique reports that can be used for sustainability and quality control efforts. This webinar will give you many practical and proven ideas to help you use OAT to its fullest. I would also like to welcome and thank our presenters for your willingness to share your expertise with us today. I will turn it back over to Pam Hine, who will be moderating today's webinar. Thanks.
Thanks so much, Mark. I will now turn the mic over to Kristen, who will kick things off with an overview of OAT. Kristen, please begin your presentation.
All right. Thank you, Pam and Mark. And thank you to all of you for taking the time to join us this afternoon for this important webinar. We're really glad that you have joined us. It's hard enough for some of us to get excited about Social Security applications, so I can attest that everyone at the SAMHSA SOAR TA Center loves it. But then when you add in data and tracking and all of this, it's a lot to ask. And we're busy, we have really important things to work on. And so why track SOAR outcomes? Why are we doing this, and why are we spending time this afternoon in particular to talk about it? And I'll tell you that my number one reason for tracking SOAR outcomes is actually not on this slide, and it's that every person counts. Every application that a SOAR provider is assisting with, every approval, every denial, it's an individual that a SOAR provider has gotten to know, who needs our assistance, who is looking for resources, for income, for stability. And you all as SOAR providers are helping to provide that. And we want to know what's going on. We want to track that work and that effort for so many reasons. And so the rest of them are on the slide here. So we want to be able to assess effectiveness. Is the work that we're doing working? Are we utilizing the critical components, and do those critical components actually have an impact on approval rates or time to decision? We want to be able to provide quality improvement. So if it's not working, are there changes that we can make to our process or our strategy to make it work better? Because again, we're talking about the impact on individuals' lives and why we're doing this work. And so we want to make sure that we're doing the best job that we can. And the only way we can know that we are doing that is by tracking our outcomes. And absolutely celebrating success. The reason that we do this work is to get that approval, get that income, see that person obtain housing and stability and recovery, and having that opportunity to celebrate with the individual, with our colleagues, with our communities is so important. And then, of course, if we can show that we are effective, that we do quality work, that we can show all of these incredible outcomes, we can secure future funding opportunities, and we can keep going and doing the important work that we need to be able to do. So that's why we're tracking outcomes. And so for those of you who are new to SOAR, you've heard, OAT is the online application tracking system. And we know that oatmeal is good for your heart health. Well, we think that the OAT system is good for the long-term financial health of your agency. Is that a nice little connection there? You're probably all a little hungry, late afternoon. Okay, so OAT is a web-based program that is allowing case managers to keep track of their outcomes. So it's free. We think it's easy to use. I think there are thousands of you out there who can help attest to that. It's accessible from any web browser. There's nothing to download. It's stored on a secure server, HIPAA compliant, and really helpful part of that, and that helps us keep information secure and compliant with HIPAA, is that we're not collecting any personal identifying information or personal health information of the applicants that we're tracking in the system. So we're really just tracking information about the application, and that's what we're most interested in, and that's how we do all of the assessment that I was talking about a little bit earlier. So OAT registration is simple. We want to know from you who you are, where you work, how you're funded, and what your intended role is with OAT. And we will talk about those roles in just a moment. Registration is easy. Like I said, it's free. And Super SOAR really said it best and more efficiently than I did. Track outcomes and get funding. So in terms of the roles in OAT, we've made it designed OAT to have a tiered system so that our state and local and agency leads can access the information that they need, the reports that they need to supervise and report on the caseworkers that are working in their kind of corresponding localities. So a state team lead is someone who is directing the SOAR initiative at the state level, and they have access to data from all the agencies in the state, and so they can run statewide reports and see really how SOAR is going across the state and in different localities. A local lead is someone who has attended one of our SOAR leadership academies. They're overseeing multiple agencies in a community, a county, or a region, and we can specify specifically what the locality is by city and county. And they have access to data from all of the agencies that are in that specified service area, that customized service area. An agency lead will oversee multiple caseworkers in an agency, and so they can access all of the data for that agency, run combined agency reports or individual caseworker reports within that agency. And then finally, a caseworker. This is an individual who's working with applicants, entering their data into OAT, and they have access to all of their own application data and can run reports on all of the applications that they have assisted with and entered into the system. I will say that everyone who has access to OAT and is registered is able to enter in application outcomes. So if there's an agency lead who wants to, is assisting with applications, wants to enter those applications in as well, they're absolutely able to do that. Same with local and state leads. So each role just kind of expands the reporting capabilities, but everyone has the same capabilities as the role beneath it. All right, so our outcomes in OAT. So how do we make OAT so easy to use? We said it was easy, right? We really focused on key outcome measures and then added some additional really important data. So we didn't want, we wanted to track everything. We wanted to ask you 200 questions about the applicants and the information because data can be so rich. However, we know all from experience the realities of caseworkers who are trying to assist individuals. And that's, our number one goal is to help that individual, and we don't want to spend too much of our time tracking outcomes and doing data and reports and all that, but we know how important it is, and so we wanted to focus in on those key items here. So we focused on the outcomes for both initial applications and appeals, and we really want to know about approval rates, time to decision, and then the completion of the SOAR critical components, so we can really assess what's working about the application process and our strategies for making it go well, and what's not working. And then the additional outcomes that we tracked related to housing, employment, and other public benefit reimbursements really helps with tracking the quality of the service we provide, and then also the financial reimbursements helps to facilitate additional funding opportunities by showing cost savings and cost reimbursements to key community agencies and state and federal agencies, where we can say, this is the effort that we've put in and what we need to be able to do this work, and look at the incredible return on that investment. And that return is pretty incredible. And I won't spend a lot of time today talking about what those outcomes are, and we're getting ready to gear up into our outcome tracking season right now, our outcome reporting for 2019. But you can see, from this infographic on the screen, the sorts of outcomes that we're able to report on, our approval rates and time to decision, cumulatively how many people we've served over the years, cumulatively how much money has been brought into state and local economies, what states are just doing fantastic or have been doing, so many applications. So there's a lot of really great, rich information that we can gather in a free and easy to use system. So here's a quick screenshot of the Caseworker Dashboard in case you haven't seen OAT before. It's really user-friendly. We wanted to make this dashboard a place where you can go to see a snapshot of your outcomes, so you can see your own individual approval rate as it compares to the approval rate in your state and nationally. You can see a little bell reminder of pending applications you have that you need to enter the decision on, and then big yellow box, enter your new applicants. You can enter new information there. You can get a snapshot of what's going on monthly. So we tried to get all that information there, easy for you to use as a caseworker. Kind of a quick glance. And then I'm going to show you a screenshot of one report, and then a few of our other speakers today will show you a few of the other reports that we have in the system and how they're used. But what's nice about these summary reports is we have a lot of filtering options where you can look at you know, the number of cases and the average approval rate and days to decision in different time periods for different application characteristics, for different locations, for different ages of applicants, if you want to look at veterans only, all of that. So there's lots of great filters that you can do to kind of drill down to the information that you're looking for. So we really see OAT as a great management tool. So like I was saying, with the different roles that we have available in OAT, you know, running reports as a state, local, or agency lead, you can see, of course, approval rates, use of SOAR critical components, whether people are actually following the SOAR model, and also see the number of applications submitted from each case manager. So maybe you are overseeing a grant and you expect that, you know, they're doing a certain number of applications in a certain time period, and you can see and confirm whether that's been done. And, you know, looking at outcomes and looking at the completion of critical components really helps to identify opportunities for targeted TA. And so we use outcomes to monitor quality. And so when we look closely at the data, we can look for low approval rates. We can see were all the SOAR critical components used. When we see low approval rates, is there a medical summary report done on all of those applications? And if that key critical component of the medical summary report isn't being done, maybe there's an association there with the approval rate. Of course, we don't know causation, but we can kind of correlate that and see, you know, what's going on? Where can we identify areas for improvement? Maybe if we're seeing a community or a group of caseworkers at an agency that have been struggling or haven't been doing a particular critical component, we can have a workshop and we can focus on medical summary reports and why they're important and how we can write them. Or maybe it's caseworkers haven't been collecting medical records and there's a barrier there, and we can address building collaborations with medical record providers, or figuring out how to avoid charges for medical records so that caseworkers will request them and not worry about the fees that they might obtain. So there's all kinds of things within the process that can be addressed in a quality review type of instance, and that can be even stronger if we do that with outcomes from what's actually happening. And then I think what is so wonderful is that it's not just about finding places where people might be struggling or outcomes might not be as high as we would hope, but it's really to celebrate those incredible successes. It's, you know, buying a cupcake or a donut for our caseworker who got their first SOAR approval and celebrating that with them, or at the end of the quarter coming together locally with all of the SOAR caseworkers and, you know, celebrating the top 3 approval rates or the top 3, you know, application completers with the most applications completed. There's all sorts of things that can be done to just really celebrate the hard work that you all are doing. And yeah, so it's another kind of great way to use the outcomes in OAT. And then finally, we have an awesome support team to help troubleshoot entering applications or running reports or answering any questions you have about using OAT. We also have a SOAR OAT user guide, which takes you step by step through all of the screens in OAT, all of the data entry, and then we have an OAT reports guide, which takes you step by step through all of the reports that are available in OAT, the filters that you can use, the different types of reports, because there's lots of different types that we can look at, application detail, summary reports, all of that, which you'll hear a little bit more about further in the presentation. So I will wrap up now and turn it over to our other speakers. Thanks.
Great. Thank you so much, Kristen. Now we're going to turn it over to Amanda Starkey, who's going to talk a little bit about Michigan's transition to using OAT. And again, to download the user guides, you'll see a link here in the chat function that you can take a deeper look after the webinar today. And you can also access them on the SOAR website and the webinar page as well. Amanda?
Thank you, Pam. Hi, everyone. My name is Amanda Starkey, and I'm a project associate for the SAMHSA SOAR TA Center. I first started doing SOAR-assisted applications back in 2010 as a case manager at my community mental health agency in Michigan. And then in 2012, I moved to Colorado, where I worked as part of the state team lead agency to help roll out SOAR there, provide training and development, and also work as a direct services case manager providing SOAR application assistance as well. I moved back to Michigan, and then I started working for the TA Center in 2017. So I have about 9 years experience doing SOAR-assisted claims, and I've used a few different ways of tracking outcomes over those years. Michelle Wolf, who is the state team lead for the state of Michigan, was scheduled to present these slides today. Unfortunately, some unforeseen circumstances came up and Michelle wasn't able to, so I'm filling in for her. But it is interesting because I have tracked outcomes using both of the methods that Michigan has implemented. So Michigan launched SOAR in 2006, and since then it's always had a very strong SOAR presence. It's headed by the Michigan Department of Health and Human Services, which is a state agency in the Housing and Homeless Services Division, and it provides statewide leadership. Currently, Michigan has 132 SOAR certified practitioners, and they are from 69 different agencies throughout the state. Michigan first began using OAT last July. So the first day of this fiscal year's reporting period, Michigan's implemented requirements to track in the OAT program. Prior to this, SOAR applications were solely entered using Michigan State Homeless Management Information System, so SHMIS or HMIS as it's known nationally. So we recently made the switch to tracking outcomes using OAT. We're here today to talk about why we made that switch, and that's what I'll do on the next few slides. The main reason or the main issue that we saw when we were coming to collecting outcomes each year was access. Michigan's HMIS system requires user licenses. Those licenses have an annual fee. You need to participate in a training to get a certificate to be able to use the program. Not all SOAR practitioners in Michigan work at an agency that has access to HMIS regularly or even at all, so not everyone was able to track their outcomes on a computer-based program. For people that didn't have access to HMIS, they were required to manually fill out some forms and fax them in, and then, as you can imagine, things got lost in the shuffle, so not all of our applications were being accurately tracked. And it was very, there were a lot of barriers present for case managers to be able to submit their outcomes if they didn't have direct access and training in the HMIS program. Another reason was the maintenance issue. So Michigan's HMIS program has dozens of programs that it oversees or incorporates into the information gathering process. It's designed and the priorities are determined by HUD. So SOAR wasn't always the top priority when we found issues that could be resolved or more accurate ways of tracking information. So when technical issues did come up, SOAR wasn't always a priority, so things were becoming outdated in the HMIS tracking system. And the third reason Michigan decided to make the switch was functionality. So when someone was going to take someone out of the program or a case had been resolved, nothing popped up that asked them to track the outcome of that application. There was also only one report available for the users, and it wasn't aligned with the SOAR annual report field. So it was hard for the state leadership to go in and find out the information, to fill in the gaps, to report accurate information for SOAR tracking. We began the transition process a couple of months before we officially rolled out OAT in Michigan. It first started with communication to SOAR practitioners. We made sure to reach out to all practitioners who had been trained and were actively completing applications to let them know that this change was coming in about May. We shared the OAT link and the user manual for OAT before we required this to be their tracking system. We always had someone available to answer questions and troubleshoot issues. So when issues came up, change is always hard. We understand that. The TA Center was there to provide assistance to help people create their accounts, or if they had any questions about how applications should be tracked in the system, the TA Center was available to assist with that. In the beginning of August, when we had our official rollout for OAT, the TA Center hosted a Michigan-specific webinar on using OAT, and we recorded that webinar so that when anyone else in the state became SOAR trained and the state leadership and local leadership got notification that that person was added to the list of people who received the certificate of completion for the SOAR online course, they were sent the link for the video recording of that webinar that we presented. So going forward, we require, as part of the Michigan certification process, when someone is certified, we ask that they sign a waiver saying that they will be tracking all of their outcomes in OAT. As soon as they get their certificate of completion for the online class, we let them know that OAT is available. We provide the registration link and follow-up details on how to register. All practitioners in Michigan are registered and enter their applications in OAT now. We run summary reports at least monthly to monitor Michigan outcomes statewide, and user summaries are ran monthly to monitor the SOAR practitioner activity on an individual level. So in Michigan, there are SOAR regional navigators assigned to the four main regions of the state, and they will review the tracking in OAT to see what's going on and see if there's any trends happening across their region so that they can follow up individually if they notice a decrease in approvals, or if medical summary reports are not being submitted with applications. They can provide follow-up and technical assistance and training opportunities. We also share our outcomes with the state SSA and DDS SOAR contacts so that they're aware of where the SOAR activity is. In Michigan, we have dedicated SOAR liaisons in all SSA offices, and we also have dedicated DDS SOAR examiners, or disability examiners, who all SOAR claims are sent to those selected people. So they have an understanding of, okay, this year we have submitted 250 applications. We have about a 75% approval rate, and we're getting our decisions in about 84 days. So they know what to expect as as far as what the workload of SOAR cases will look like and how quickly we're getting decisions on the applications being submitted. The individuals who use OAT, we highly encourage them to run reports as needed to monitor their SOAR activity and look for trends in the agency or for themselves. If they notice that their approval ratings are slipping, they can see what's going on, if there's any commonalities between the applications that are getting approved compared to the applications that are not getting approved, and reach out for technical assistance to talk about what they can do to improve their outcomes. Or if they have really great outcomes, we always encourage them reaching out to state leadership and the Technical Assistance Center to let us know so that we can share that information on our bi-monthly statewide calls. This is a picture of the SOAR user summary report for OAT, and it is what will pop up if you are looking at a summary of who is using OAT in your region or state and how many applications they've submitted. So it's a really helpful tool just to get a quick snapshot of what's going on with SOAR in your region or state. All right, so I think I'm turning things over to Pam again to introduce our next panelist.
Great. Thank you so much, Amanda. We appreciate the overview of and your experience with what's going on in Michigan in terms of the transition over to OAT and how it's been very helpful to manage quality and see if SOAR is working, which we know it is working quite well in Michigan. Now we're going to turn it over to Barbara Moody-Holbrook, who's going to share a perspective of using OAT in Florida. Barbara?
Hi, thank you, Pam. It's a pleasure to be here. My name is Barbara Moody. I work for Southeast Florida Behavioral Health Network. We are the managing entity in Circuits 15 and 19 in the state of Florida. I actually started with SOAR back in 2007. I worked for an agency that was ending homelessness in Palm Beach County. I eventually came to the managing entity 4 years ago because I knew that I could outstretch my hand within the agencies in the northern counties to build our SOAR community. Let's see. Try to get these slides to go over. I don't know why they're not moving.
I can change for you, Barbara.
Thank you. Thank you so much.
Yep.
So I'm ready to move. So we do have a standardized process. It has been in place since 2007. Actually, what's taken place, there's a lot of changes that has been made, a lot of revisions within Social Security Administration. The reason why we used OAT originally is to have those conversations with Social Security Administration so that they could see the good that we were doing in the community, and that built very strong relationships with Social Security Administration. We have had several of the Social Security Administration liaisons that have really stepped up to the plate in their offices. We do have SOAR dedicated liaisons in all of our county Social Security offices. They have spreadsheets that they maintain for all of the SOAR applications that come through their offices, and we kind of cross-reference them so that way we can make sure that what the data is we have in OAT is matching the data that they have coming into their administration offices. Our SOAR liaisons have been invited to all of our SOAR work groups that we have on a monthly basis. Sometimes they attend, sometimes they cannot. They have been invited to the majority of the trainings that are involved down here in the state of Florida. And inviting them into our world actually allows them to see what we're doing, and it just builds a better relationship across the board with them. The SSA SOAR Liaison Benefits, it is about developing that relationship with Social Security. We cross-reference data. We confirm what applications are actually coming into the SSA office and what case manager is putting those out. We have a great relationship when it comes to the SSA liaisons. They contact me right away when there's something that's awry with any of the applications. That way we can have conversations with the SOAR dedicated specialists or the case managers that are submitting those applications. We have weekly conversations. So those SOAR liaisons are our go-to people. They are our single point of contact in the SSA offices. We always have changes that are taking place with Social Security Administration and the standardized process. So we're in constant communication so that way we can maintain those relationships. They are not afraid to give feedback on any of our applications and what we can do to, strengthen our application process. So introducing OAT to the SOAR community, I have made it a challenge in my time at the managing entity to strive always towards better outcomes in the OAT system. Of course, I'm the local lead down here, and I feel that it's my responsibility to make SOAR a community effort. And in order to be recognized by the National Technical Assistance Center, we need to have better outcomes. And so over the last few years, I've talked about OAT, and I've talked about how we can build those better outcomes. Right now, our SOAR dedicated specialists, we have 8 down here in the state of Florida. That's their main job, is to do SOAR applications. We have conversations and emails back and forth on what we can do to build these outcomes, and they're working. They're working. So it is all about celebration on the successes, and it's looking at the ones that were not successes in order to, what can we do different? What can we do better? Training on OAT is critical to proper and consistent usage. If you're putting in information into OAT and you're putting it in too soon, we have to request, our state lead to go back in and recreate that for us. So making sure that the information we're putting in initially is correct. We talk about that at every SOAR work group. So tracking success with OAT, with one SOAR dedicated specialist, the agency did not have, they had people trained. However, they were not submitting any applications for SOAR. They had some lapsed dollars at one point when we were doing a contract validation, and noticed the lapsed dollars, and we thought, well, let's just give you some more and hire a SOAR dedicated specialist. Once this individual was in place, within a year and a half, she did 68 applications. She submitted them to Social Security Administration. 44 of those were approvals, and 24 of them were denials. I went back in to validate them into the reconsiderations, and there were 12 approvals and 7 denials, and 1 approval at the law judge hearing level. So all of this average was up to 72 days per decision. So that's an amazing feat to be able to go into OAT and see how one agency has changed the lives of so many people. So using OAT as a management tool, it all begins with quality applications and using your SOAR identification screening tool. Obtaining all decision letters prior to inputting the final data into OAT, that's crucial down here right now. That's a whole conversation that we're having in Florida right now, is about waiting until you get your award letters in order to put that information in. Reviewing reports allows supervisors and CEOs to see the need for SOAR, which they start looking for grant money. And tracking Medicaid reimbursement shows a return on investment. The one agency that I spoke about, one person had $14,000 in retroactive benefits that came in when they were approved. And so going back to look at the Medicaid reimbursements was very nice for that agency to see. So here's the applications page. You can go in and you can look at who's submitting what applications from what agency, especially if you're a local lead. You can see any of the denials that come on and have a conversation with what was the reason for the denial and what can we do to make that different for you, and are you filing a reconsideration in order to get an approval? The applicant overview. This is a page inside of OAT that you can go in and look at what they were approved for, if it was SSI or SSDI, how much that monthly amount was. It also looks at if the individual was housed, were they housed during the process of obtaining SOAR benefits, was there a representative payee needed, and how many hours to complete the claim. It has so many different components in here about especially the crucial pieces of it. The 1696 and medical records were collected by the SOAR dedicated specialist. And then also with the medical summary report co-signed. The co-sign makes a huge difference in our SOAR applications when they go to DDS. So using OAT as a management tool, providing technical assistance for each person once they're trained. So since I came to the managing entity, I've been able to go and meet the trained person and provide them technical assistance on their first couple of applications so they don't, get confused or feel overwhelmed and feel like they don't want to do this process. Because they can find all of the tricks that, bring it in, and then meet the Social Security liaisons so they feel more comfortable working with that government agency. We have ongoing conversations, whether it be face-to-face, we talk on the cell phones, we text message each other. This is strengthening our relationships. It's also strengthening the bonds in the community and with the people that we're serving. We establish collaborations with medical departments, which sometimes it's very difficult to get medical records departments to send in the medical records. Sometimes they'll charge $1 per page, which is the Florida statute. And we've gotten them to where they really release those records for free for the people that the ones that we're serving. Reinforcing with the people that are trained in SOAR the correct use in OAT, and then leading work groups. These these SOAR work groups on a monthly basis has really shifted that discussion on OAT and how this is really the management tool, how it's actually bringing funding into the community. So OAT discussed in the SOAR work group. Here's some of the areas that we talk about. In this monthly meeting, we network. They all come, all the SOAR dedicated specialists come together, and it makes it very refreshing to meet somebody else that's doing SOAR applications. So they really enjoy meeting each other and sitting and talking. They're able to vent any of their frustrations that they're having, whether it be
Hi, Barbara. I think we lost your audio. So we'll ask Barbara to call back in, and what we'll do is once Barbara calls back in, we will ask her to, finish up her slide presentation, because I think that we don't have her right now. So what we will do is we will move into our Q&A session, and take some of your questions, and again allow Barbara to continue discussing her slides. And I think that this slide, Barbara's very last slide, is very telling because it really gives the 5 reasons that they've identified as to why it's really important for you to utilize OAT and to enroll in OAT to track your SOAR outcomes. They find that OAT is user-friendly. OAT is free, so the state doesn't have to expend any dollars on creating a system. If you ever had questions, contact your SOAR state team lead, local lead, or SAMHSA SOAR TA Center liaison. OAT reports at the local level are key for your SOAR state team lead when submitting annual outcomes to SAMHSA. Very important, as Kristen also mentioned. Accurate OAT input drives sustainability, so don't hesitate to ask for help. And I think Barbara really drove that point home, that it's allowed them to show SOAR success, increase staffing of SOAR dedicated specialists, and really show how outcomes really are changing lives for the folks that they serve using the SOAR model. So I think these are 5 really great takeaways from Barbara's presentation. And again, the benefits to your SOAR community, that is really through understanding and striving to develop and maintain SOAR community buy-in. Absolutely, data helps that to show. It's easy to show, outcomes using the SOAR model, to show those decisions, again, in a very nice report. OAT is also a crucial component to prove the hard work we put in does indeed work. We, as Kristen said, we want to count your hard work. And hang in there, OAT does work. Again, we do provide user guides to make utilizing OAT simple, but even Barbara's community does meet regularly to talk about OAT, any issues they're having with OAT, and bringing up some of those issues to the TA Center, to SAMHSA, so that we can make OAT even more user-friendly too. So now we're going to open things up to Q&A, but I see Barbara has joined us through audio. Barbara, can you hear me?
Yes, I can hear you. Thank you.
Do you want to go back and do some of those slides? I think you were probably.
Oh, that's fine. That's fine. I think you did a fantastic job by following up. Thank you so much.
Oh, right. I didn't want to put words in your mouth, but again, I think your slides really do drive the point home how important OAT is to sustainability, and showing that it is absolutely working. And where it's not, how we can provide targeted TA to make SOAR work even better. So we're going to take your questions now. So how to ask questions. So put your question or comment into the Q&A panel, which is located on the right side of your screen. Again, if we're unable to get to your question, we'll distribute to the appropriate panelists to answer afterwards for follow-up. So we do have questions that have come in. One of the questions is, how do I know if my state utilizes OAT? Kristen, do you want to take that question?
Sure, that's a great question. So the best thing to do would be to reach out to your SOAR state team lead or SAMHSA SOAR TA Center liaison and ask, how are we tracking outcomes in our state? Most states use OAT, but it is good to double check.
Great.
And we can put in the chat box the link to the SOAR directory. It's there. So the link to the SOAR directory is in the chat box. So you can find your state team lead and SOAR TA Center liaison there. And actually on the state page, most state leads have indicated how they track their outcomes on the state overview. So when you go to the directory and looking for the contact information, there's kind of a summary of how SOAR works in the state, and most of them will indicate how they track outcomes.
Thanks, Kristen. There's a question. Can I enroll in OAT if I have not completed SOAR training? Kristen?
Oh, that's such an excellent question, and I meant to cover it during my presentation, and I forgot, so I'm so glad you asked. So the short answer is no, that everyone who is entering outcome information in OAT needs to have successfully completed the SOAR Online course Adult Curriculum or Child Curriculum, or completed a 2-day Stepping Stones Recovery training, the old version of the SOAR Online course, but that would be for people who were SOAR trained some time ago. Yep, and so you indicate how you have been trained when you register, and then we confirm that training before you are granted access and able to enter in outcomes. We do that because we're only tracking SOAR outcomes and SOAR-assisted SSI and SSDI applications, so we want to make sure that everyone who is tracking outcomes in the system has been trained how to use the SOAR model and is using the SOAR model, because that's our intention, is to track those SOAR-assisted applications.
Great. There's a question. Can I use OAT to track children cases?
Yes, absolutely. So we now, as most of you know, and if any of you is on there doesn't know, we have the SOAR Online course Adult Curriculum, which is the original SOAR Online course and SOAR training. But in October, we released the SOAR Online course Child Curriculum and officially launched SOAR for Children. So we have trained caseworkers out there who are assisting with SOAR-assisted SSI applications for children, and those applications can absolutely be tracked in OAT. The way that OAT tracks applications by age is by asking for the age of the applicant. We don't track a date of birth because that is too much of personal identifiable information, but by tracking the age, we're able to sort the application in filters in the reports by anyone who is under the age of 18, or if you're serving a transition age youth population and you want to track applications for people that you've submitted for, who are age 18 to 25 or 16 to 24 or whatever it might be, you can customize the age range. So that was a long way to say, yes, absolutely, any age applicant, you can track it in OAT.
Great. Thanks, Kristen. We have a question from Mary. Do I add all clients to OAT even if I have had loss of contact and the application was not completed?
Mary, that's a great question. So if you did not actually submit the complete SOAR application, so you didn't submit all of the forms and the medical summary report and all of that, then you don't need to track the application in OAT. However, if you did, complete the SOAR process, you submitted all of the application materials, and then had a loss of contact, you could track that application in the system, and there are options for indicating loss of contact, basically. So if you don't know the decision on the application or something like that, you can add that information in. So that way, you know, you're tracking the effort you put in to doing that application, but you may not ever know the decision on the application, or it may not be a complete decision because the individual wasn't able to complete the process. And so you can indicate that in the system.
Thanks, Kristen. Here's a question from Sue. It's one of the user type of questions, a more technical question. For Sue, it was advised for her program not to enter an application in OAT until a decision is made in order to leave the option to change SOAR caseworkers if the case is transferred. As a result, we don't really have any way to see how many applications are being processed, any advice. And I know Barbara, her program, may enter data after a decision. So any advice for Sue on the best time to enter an application in OAT? And again,
so, yeah, sorry, Pam, I'll answer and then invite Barbara to also add, you know, what they do locally too. So each agency and locality makes a decision about when to enter the application. And I'll tell you that, you know, we think that it's great if you can enter information when the application is pending, because then you have a reminder that that the application is pending and can follow up on the decision. So like one of the things we've recently done at the SOAR TA Center is email all of the caseworkers in OAT who have pending applications to follow up and say, hey, have you gotten a decision? And that gives us the opportunity to do that if the application's been entered at that stage where there's a projected filing date for the application. The good news is that if you have, you know, multiple caseworkers in an agency and you enter the application and then it needs to change caseworkers within the agency, we can very easily make that transfer. The way that OAT is organized, the application belongs to the agency rather than the caseworker. It's in with the caseworker, you know, when they enter it in that caseworker's reports, but we're able to transfer the case within agency from caseworker to caseworker because of, we know about, you know, turnover issues. We can't transfer the case outside of the agency, so it can't follow a caseworker if they go from one agency to the other. It stays with the originating agency. So that's the only caveat there, that if the caseworker leaves an agency and goes to another, we can't move a case with them, but we can move a case to a different caseworker within the same agency. So it's a little complicated, but we can always, you know, if you have something really unique come up, we can always solve it on the back end. You know, we have ways that we can kind of fix data entry or data belonging in the system. We really want to kind of make it work for you. So if you aren't sure about something, or you have a case that you've entered, or a caseworker is leaving or whatnot, reach out to us at soarinc@prainc.com, which is our OAT support email, and we will solve the problem. So Barbara, I wanted to invite you to mention what kind of instructions you give to caseworkers in your locality about when to enter their data.
So we're looking at individuals that are experiencing homelessness, and most of the agencies here put the application in OAT once they submit the application, and that is mailed over to the SOAR liaison. Now, if the person does not come back for whatever reason, they get lost, and this happens a lot with our forensic population as well. They get lost, they don't come back, but our team gets a decision. They still get the decision if this individual is approved or denied, and so they put it into OAT once they receive the decision.
Thanks, Barbara. Here's a question about maybe some of the capability of OAT. The question from Ellie is, can individual agencies compare their results to other local agencies?
So, Elliot, that's a great question. And it would be up to the agencies to be willing to share their information. So let's say you have a group of agencies coming together to have a SOAR caseworker group or just a kind of a local group that's meeting about SOAR. Each could voluntarily bring their summary reports and all of that. Local leads and state team leads may have access to multiple agencies' data in that way and be able to compare, outcomes between agencies, but that's a level of access granted to local and state leads.
Thanks, Kristen. Here's a question from Sue about OAT and customization. Is there any customization in OAT? For instance, we want to track where the referral came from. Does OAT have that capability?
So we don't have the capability to track referral source. And, one of the balancing acts that we play with OAT is that, like I was saying kind of at the top of the webinar, we didn't want to add too many questions to make it too time burdensome, but we wanted to add enough where we could really make it useful. And the other challenge we have is that because this is a federally funded program and federally sponsored kind of tracking system, that all of the questions that are in the system have to be approved and kind of authorized to ask the public by OMB. And so we have OMB clearance, kind of technical term for like what we have for this kind of surveying and tracking system that the public uses. And so because of that, we're limited in how we add or expand questions. However, we can sometimes use the system in the way that we have different roles and agencies and localities that we have gotten creative with how we can keep track of things like a referral source. So if you only have a few, maybe we can get creative with how we have multiple user logins for a different user referral source. So if you have like 3 referral sources that you use that you want to track, and you have a caseworker who's helping with applications from those 3 sources, maybe they have 3 logins that they use in OAT to track the applications from each of those sources, and then they could run reports. So all of my applications from referral source 1 were approved. All of my applications from referral source 2 were approved, and only half of my applications from referral source 3 were approved. I wonder if I'm not getting referrals for potentially eligible individuals from 3. Maybe we need to talk about the appropriateness of those applicants, that sort of thing. So we could kind of get creative with how we do caseworker login to try to track that piece of information that we aren't necessarily able to add to the system. I hope that helps.
Thanks, Kristen. And it sounds like Barbara's SOAR work groups may discuss things like that, the data that they collect in OAT, what additional information may they want to learn. So Barbara, a couple of questions came in about your SOAR work groups. What kind of issues do you discuss about OAT in some of these work groups that you have?
Well, part of our SOAR work groups and bringing up OAT is looking at the data from my end and then making it somewhat competitive amongst the agencies. I can ask permission prior to the work group, is it okay to share how many applications you have in this last quarter? And then I can put that out there, and then they start looking to, match each other. And although it's not about quantity, it's about quality, we refer to that quite often, but they do compare notes on the data, which is very helpful for them.
Great. And so, Barbara, we have a question, and I think it came about because you mentioned that you share your OAT reports with your SSA and DDS, so they see Again, the number of applicants and applications and the quality, so you share with them. So we had a question from Laura asking, how can I go about setting up a SOAR SSA point of contact? I think you used the word dedicated SSA agent, but a SOAR point of contact in their local field office. And I would just suggest that you certainly, Laura, would want to reach out to your SOAR TA Center liaison for your state, and also reach out to your state lead if you're not sure, because we can really help establish that relationship for you. And again, any of the panelists really want to weigh in on anything else that you can talk about in terms of establishing your SSA contact, and maybe Barbara about how you've been able to get them to look at that OAT data and how it's helped them, do their work with SOAR.
Well, the SSA office, they keep a spreadsheet. And in the West Palm Beach office, our liaison there actually monitors in that spreadsheet if there's a new case manager that's submitting submitting applications. Are they on his spreadsheet for submitting applications in the past? And if they're not, he'll contact me and ask me if they've been trained. That's one of the areas. Also, when we look at the OAT data and compare it to his spreadsheet on the applications that he has sent in, I can then go back to the case managers and say, I see this in here, and here's the outcome of that decision, and I don't see it in OAT, and maybe they had forgotten to put it in there. One decision makes a huge difference at the end of the day in your data.
Yes, it does. That was very helpful. And again, I just will reiterate, to find out who your SOAR TA Center liaison is, you can go to the SOAR website, click on your state, and then you'll see the state lead and your liaison's information, and you will also be able to click on contacts and see if you do have a local lead in your area too. We also put in the chat a link to our SSA and DDS collaboration guide. It will really walk you through, how to establish some of these relationships as well. That'll be a great tool for you too. So I would suggest that you check that out as well to find out more information about that. We have a question here about, does OAT take any space on our server?
No, nope, it's all our server. Yep. So it's just a website you visit.
Great. I think that's helpful to know more about. Here's a question for Florida. From Tina. I live in Southwest Florida, and I'm interested in being SOAR certified. Where do I start? Also, is OAT available in Florida? I am going to pass that to Barbara.
So Jazra Aware is our national lead for SOAR. If you go into the SOARworks website, you'll be able to go into Florida and get the contact information for our state team lead and our national team lead. There's also a managing entity that has a SOAR local lead in all of the counties, and so they would be able to assist you as well to get SOAR set up in your area.
Great. Thanks, Barbara. And Florida definitely uses OAT, and Barbara has attested to that. Okay. Here is a question about, let's see, we have some questions related to the applicant ID. How do I make sure that should a caseworker leave the agency, what are tips for making sure that we can easily transfer that case to the new case manager? And what are some tips on making sure that applicant ID is accessible to the new case manager? I'm wondering if Barbara may have any tips on that, or Kristen.
I can say that I've worked with DASRA, where our state team lead, our national lead for the state of Florida, and there's been several occasions that case managers have left the agency and they've had a number of applications that are pending, and the new person that's taking over those claims, DASRA has gladly gone in and transferred those over. And those IDs are HIPAA compliant, and they should have the files, that you're stepping into that role. They should have those files available that you'll be able to distinguish, I'm hoping.
Great. Thanks, Barbara. And if it's all right, this is Kristen, I'll just add, you can email us at the SOAR support email, and we can, get those transferred over. So any of you that, specific things that come up where you need to transfer cases, if you reach out to us, we can make sure that the new caseworker is registered, make sure we take the cases from the former caseworker, get those transferred, all of that. So we can handle all of that for you, no problem.
And also, from experience with some of the states that I provide TA to, often the SOAR caseworker will have a file cover sheet in the applicant's file, and on the front, on the top, maybe near their name or social security number, they'll also list the applicant ID. So that's readily available for anyone to have, again, should there be a case transfer for whatever reason from one case manager to another, actually writing it on the cover sheet of the applicant's physical file too. So that's just one pointer for that. Here's a question that came from Sarah, not OAT related, but again, very important to have an idea. Are local leads typically government or agencies themselves? Can maybe Kristen talk a little bit about local leads? Who are they, and what do they do?
Yeah, that's a great question. So our local leads come from all sorts of backgrounds, all sorts of agencies. So sometimes they represent government, so maybe they work for the county government or the state government or local government, and they work for the the Department of Mental Health or Department of Homeless and Housing Services. So that definitely happens sometimes, and then other times it's organizations in the community who are serving the SOAR target population. So they're serving individuals who are experiencing our risk of homelessness, who have a serious mental illness, and so these are nonprofit agencies who are providing direct care. And so our local leads are folks who step up and say, I am willing and available to help lead the SOAR efforts in my area. I want to help pull together steering committees and SOAR caseworker groups. I want to help facilitate SOAR online course cohorts and help support caseworkers in my community and help answer questions for them and build a real kind of local community and local structure for SOAR implementation. And Barbara's a great example of a SOAR local lead who we have, and who works at a local agency funded by state government, and so there's kind of an interconnection there. So yeah, that answers that question.
Great. So Barbara, this question may be directed to you, since you do share your OAT data with SSA and DDS. This question comes from a participant that asks, she's the only one doing SOAR in her county. How do you get DDS and the local SSA field office on board with OAT? I do not have a specific DDS office she works with within the state, let alone a specific contact. I'll take the second part of that. Please reach out to your SOAR TA Center liaison for your state, who can really help either establish that relationship or let you know if there is one that exists, but certainly help you establish that relationship. hopefully that SSA and DDS collaboration guide will be a benefit from you as well. But I would certainly encourage you to reach out to your liaison. But any tips for how to introduce OAT to, how did you introduce OAT to your DDS and SSA office, and what was appealing to them about looking at the OAT data? Barbara?
When it comes to OAT, I think originally they were not willing to be involved in that aspect of it at all. They didn't want to know what we had. And continuing on building the relationships, you know, showing up, showing them what the community is doing, looking at all the efforts that were taking place in our community, continuing to talk to them about, you know, the outcomes. Then their offices were able to see the outcomes coming in because of the conversations they're having with the SOAR-trained individuals. They were willing to talk about data. And, you know, it's just, this is all about building relationships. I mean, and data works because what the new person that stepped in to our West Palm Beach office, he realized that, you know, this is really giving him a lot of good data for their office as well. And just for us to be able to look at it together, it's all successful relationships.
Well said, Barbara. Thanks. Hopefully that gave you know, some participants some food for thought on how to introduce OAT if, again, obviously something new, and you know, can really help them, you know, understand how SOAR can work best, you know, for everyone involved. Here's a question that may, it's obviously from Annie, who has some experience in entering in OAT data. She had a kind of a comment and a question too. She wishes there was a simple do not do and why section instead of doing the whole OAT entry. So I'm wondering if Kristen can provide, you know, just some maybe tips or guidance on that for applicants that you end up not submitting a claim.
So for an application where you haven't submitted the claim, at the beginning of the data entry portion, before it asks you all of the questions, there's an opportunity to say, I didn't submit the application, and then you can say the reason for it. So once you would have to put in the demographic information at the beginning, and then the protected filing date. But then you can, you can stop at that point and say, did not file the application, and indicate the reason there. If you didn't even initiate the application, I would say it's not appropriate to enter into OAT anyway. So you could just kind of skip that part. If you are not initiating and starting the process, there's no need to track that in the system. The system's really about tracking the applications that are getting full SOAR assistance.
Thanks, Kristen. Again, if you have issues, hopefully that helped. Because, again, not having to enter in all the information. Again, if you have issues like that, use the SOAR OAT dedicated email. Reach out to your liaison, your TA Center liaison, to really help troubleshoot that along with you. Because, again, our goal is to make OAT really easy to use, and so you're not spending a lot of time on entering that data, and it really becomes something that really becomes your friend, and something that you look forward to checking your dashboard and checking your progress and all of that great stuff. So we're really glad to hear some positive, wonderful feedback about OAT and how OAT has really helped them do their job more efficiently, and again, also has helped fund their position because they've been able to show their data to potential funders. So we're really, really heartened to see some of these wonderful comments come through. We thank you for that as well. Here is a question, not necessarily OAT related, but I think others may have this question as well. If the SOAR application is completed and the applicant calls, hold on one second, if the applicant, I just lost it. Okay, if a SOAR application is completed and the applicant calls and gets an SSA office appointment to apply for the SSI benefit, can the SOAR application be submitted then? I'm sorry if this is kind of confusing, but if a SOAR application is completed and the client calls and gets an SSA appointment to take the SSI application, can the SOAR application be submitted then? So this is not necessarily OAT, but more of a, you know, you've that SSI, that SSA calls to take the SSI application because it looks like you've started, you've entered too much information while you started the SSD application online. So Kristen, did you want to kind of follow through on maybe providing some feedback?
Sure. I mean, it sounds like if you have the application materials ready to go and are available to go with the individual to the appointment, it sounds like, you know, an opportunity to get things turned in. So, you know, this may be a good case for us to chat over the phone or via email with some more details about, you know, what's going on with the application. But, you know, generally, you know, going in person is never a problem with an application. It's something we avoid sometimes because it can be hard for applicants. But if the applicant, you know, wants to go and you're available and can bring the materials that you've already prepared, that's great.
That's great. And again, if you're not sure what your SOAR process is in your locality, because that's part of it, not, again, as going into the office to have the applicant do their SSI application. So again, reach out to your TA Center liaison, you know, find out how you can kind of avoid that happening again so that you can submit the application altogether. And again, having a contact person at your Social Security field office you can talk to so that maybe, you know, they can, you know, not necessarily have to go to that appointment because they know that you will be submitting the complete application in a timely manner too. Here's a question from Charles. How do we deal with situations where a SOAR dedicated specialist moves from one agency to another? It's my understanding that the applications, in quotes, belong to the agency. Kristen, do you want to tackle that one?
Yeah, so you're correct that the application, quote unquote, belongs to the agency. So we can only transfer the case to another caseworker within the agency of origination. So when the application ID is entered and the application starts its tracking, it'll stay with that agency. So either get closed out with the original caseworker, like maybe the caseworker leaves and you're just waiting for the decision letter, somebody else could log in or we could do it on your behalf, enter in the decision, and then just leave it with that caseworker at that agency. Or if someone else is going to take over the case at that agency, the app ID can get transferred to that new caseworker at that same agency. But if the caseworker goes and gets another SOAR job at another agency in the community, the case cannot transfer with them. It has to stay at the originating agency.
Great, thanks. Here's a question from Candace. My client was approved back in April, but I'm not sure of all the details of his approval yet due to SSA recently replacing me as the authorized representative through the 1696. Should I fill out the OAT outcome even if you don't know all the answers to the questions asked? So it's kind of a SOAR, an OAT process type of question.
Yeah, so the key things that you will need to know are the date of the decision and what benefit they were approved for. So that key information is necessary for it to be a complete record and OAT and show up, you know, in the outcomes and in the reports. If there's not a date of decision and what the decision was, we can't do anything. It'll kind of stay as a pending application. So one thing you might be able to do is if you, you know, are no longer the 1696 representative, but you're still working with the now beneficiary, congratulations on the approval, you could ask the beneficiary to, you know, sign a 3288, which is an authorization to disclose information, and try to get the date of decision that way, or, you know, call SSA with the new beneficiary with you to find out the date of decision, or see maybe the beneficiary has the letter, and you could check on the letter there.
Great. Yep. You need that date of decision. Perfect. Here's a question from William. Can I still record my results if I become involved after the applicant began the application by themselves, but later became the representative? So the case was not begun as a SOAR case, but was completed by a SOAR worker. I think this is another good OAT process critical component question. Kristen, do you want to tackle this one?
Yeah, that's a really good question. It's a common question we receive, and you know, it happens quite a lot. And the answer is, if you are using the SOAR model and you help collect medical records and you write that medical summary report and you assist the individual to get that application processed to completion, then absolutely track it as a SOAR assisted application. If you don't, you know, assist with the application, you just happen to be engaged with an applicant who is applying, then you wouldn't track it as SOAR. So, you know, it's kind of looking at how much have I assisted with the application? Did I give this application the full SOAR treatment or not? And what we're looking for in the SOAR OAT system is to track those applications that got that SOAR assistance. Okay. But it doesn't matter who set the protective filing date. You know, that's it's okay if the applicant did that.
Great. Here is a question. Let's see. Some people have asked, how can I connect with other SOAR groups? And I think that's a wonderful question, you know, to ask about connecting to other folks doing SOAR. And I'll just go back to, you know, find out who your SOAR TA Center liaison is, find out who your leads are, you know, within your state. And again, find out if you have any local leads in your area. It's a wonderful place to start because you do have their contact information to reach out. If you're looking to, you know, contact folks in other states, you know, like Barbara, for example, because you want to replicate what she's doing, or even Michelle Wolf, who was not able to be on this call. If you want to contact her to find out, hey, how did you do that in Michigan? You can, more than welcome to reach out to our state and local leads who presented today. They're more than happy to share, you know, what has worked for them. You know, even Barbara shared, you know, it took time, you know, for SSA to get on board with really digging deeper into their OAT data. So that's just my advice. I don't know if anyone wants to, you know, chime in on how to reach out to other SOAR groups, I guess, in your state and maybe nationally. Definitely find out who your liaison is. I think that's a great start, and they can start a good dialogue with you about what's going on with SOAR and other areas that you may want to touch base with to see how you can replicate what they're doing. It looks like we have run out of time. We've answered a lot of your questions. We didn't get to everything, but I assure you that we will reach out to you individually to get your question answered. So again, I really want you to, you know, take a moment to complete the evaluation, which you'll see upon exiting the webinar. Your responses really help us to inform future webinar topics. We will be doing our last webinar in this series in August, on a date in August, on medical summary report writing. So look for registration information to come soon about that. And so again, on behalf of the SOAR TA Center, we'd like to thank you for taking time out of your day to learn about OAT and how to use OAT. Some of those next steps, again, get in touch with your liaison, register for OAT, use those user guides to help you with that, and begin tracking your SOAR-assisted SSI and SSDI applications, as Barbara and Amanda attested. It really has helped those programs grow and help serve and change the lives, using Barbara's words, tremendously. So again, we want to thank you, and don't hesitate to reach out to us. And again, have a great rest of your day. Thanks again. Bye-bye.